Hey guys, so today I'm going to be talking about breathing recovery exercises, and these are exercises to help people with different types of vocal cord dysfunction manage their situation. This is frequently used in patients with paradoxical vocal fold motion and chronic cough, whose vocal folds will not separate for breathing. So these exercises are also trained in the absence of triggers. So once they become automatic, they can be reintroduced into therapy to practice the recovery in the setting that they will be used in. And these exercises are a symptomatic voice therapy because we are directly modifying the symptoms experienced by the patient to improve their voice quality. And so breathing recovery exercises are made up of 3 steps. The first step is body awareness training via a progressive tightening and relaxing activity. So first the client is asked to lie down on the floor or on a mat, and then the clinician then guides the client through this activity. So first, overall there should be about 15 minutes at the beginning of a session. So first, the clinician will tell the client to focus on a specific muscle group for like the jaw, for example. And then the clinician will then tell the client to take a slow, deep breath and tense up the jaw muscles or whatever muscle area you're working on. And then after holding the muscle tension for about 5 seconds, the client will then exhale and relax the muscle. And the client will remain in this relaxed state for about 15 seconds. And then you move on into the other muscle areas that you want to work on. Now, step 2 is training the lower abdominal and rib cage expansion during inhalation. So this is when you have the client sit comfortably or lie down while placing one hand on the chest and one hand on the belly. And then the clinician will ask which hand moves more, and then the client will then focus on letting air out by moving the belly button inward and then relaxing the belly and letting air come through the lungs and just going through this. And then that brings you to step 3, and this is our rapid deep nasal sniff or oral straw sip inhalation, followed by complete exhalation using a front sibilant or fricative sound, so either an S or an F. So this sniff is to activate the PCA muscle, and it is an audible sniff, and it can be a longer sniff or several short sniffs. And this should be practiced for 2 to 3 minutes, 7 to 10 times per day to make it automatic, so that when someone may have a breathing attack, they are able to do this. So this step will look something like this. And that's it.